Hey everyone, and welcome back to the channel. Today we're tackling a topic that's genuinely scary but incredibly important. What to do if you suddenly find yourself unable to breathe. It's a terrifying situation, but knowing the right steps can make all the difference. We're going to cover the common causes, the immediate actions you can take, and when to call for emergency help. This information could one day help you or someone you love, so let's get right into it. First, let's understand why this might happen. Sudden difficulty breathing, or dyspnea, can stem from various causes. It could be an asthma attack, a severe allergic reaction known as anaphylaxis, a panic attack, choking on an object, or even a more serious underlying medical issue like a heart problem or a collapsed lung. The key is to quickly assess the situation and act accordingly. Panicking is a natural response, but it often makes breathing even harder by constricting your airways. The goal of the techniques we'll discuss is to help you stay as calm as possible and maximize the air you can get. So, you're gasping for air. What's the first thing you should do? Your absolute first priority is to try and remain calm. I know it sounds impossible when you can't breathe, but panicking releases adrenaline, which can speed up your heart rate and breathing, making the situation worse. Try to focus your mind. Tell yourself, I need to calm down to breathe better. Take slow, deliberate mental steps. Acknowledging the fear without letting it take over is a crucial first step. Once you've done your best to control the initial panic, immediately call for emergency services. In the US, that's 911. In the UK, it's 9999. Know your local emergency number. If you can't speak, most emergency systems now have a text option. Have your phone ready and get that call started. The dispatcher can guide you while help is on the way. Now, let's talk about trick number 1. Pursed lip breathing. This is a classic technique taught for conditions like asthma and COPD, but it's fantastic for almost any situation of breathlessness. Here's how you do it. First, relax your neck and shoulder muscles. Breathe in slowly through your nose for a count of 2, keeping your mouth closed. Then, purse your lips as if you're about to whistle or gently blow out a candle. Breathe out slowly and gently through your pursed lips for a count of 4. The key is to make your exhale twice as long as your inhale. This technique helps slow your breathing pace, relieves shortness of breath, and promotes relaxation. It works by creating a little bit of back pressure in your airways, which helps keep them open longer, allowing you to get more stale air out of your lungs and make room for fresh air. Practice this right now while you're calm. Inhale through the nose for 2, exhale through pursed lips for 4. It feels good, right? Remembering this simple rhythm can be a lifesaver. Let's move on to trick number 2. Find a supported position. When you're struggling to breathe, your body uses extra muscles in your neck, chest, and back to help you, which is exhausting. Finding a position that supports your body can reduce the strain and make breathing easier. One of the best is the tripod position. Sit down in a chair and lean forward, resting your elbows on your knees or on a table in front of you. Let your head and neck relax. This position allows your diaphragm, your main breathing muscle, to move more freely. If you don't have a chair, you can do a standing version. Lean forward and rest your hands on a sturdy surface, like a countertop or a wall, keeping your arms straight. This takes the weight off your chest and gives your lungs more room to expand. Avoid lying flat on your back, as this can make it harder for your diaphragm to work, especially if there's any fluid in your lungs. Leaning forward is your best bet. What if your breathing difficulty is caused by a severe allergic reaction or anaphylaxis? This is a life-threatening emergency. Symptoms can include not just trouble breathing, but also hives, swelling of the face, lips, or throat, and a rapid heartbeat. If you know you have severe allergies and carry an epinephrine auto-injector, like an EpiPen, use it immediately. Don't hesitate. Follow the instructions, which usually involve injecting it into your outer thigh. Even after using the injector and feeling better, you must still go to the emergency room. The effects of epinephrine can wear off, and a second, delayed reaction can occur. If someone you're with is having an allergic reaction and has an auto-injector, help them use it if they're unable to. Another common cause of sudden inability to breathe is choking. If you're choking, you won't be able to speak, cough effectively, or breathe. The universal sign for choking is grabbing your throat with both hands. If you are alone and choking, you can perform the Heimlich maneuver on yourself. Make a fist with one hand and place it slightly above your navel. Grasp your fist with your other hand. Then, bend over a hard surface, a countertop or chair will work, and shove your fist inward and upward. This forces air out of your lungs to dislodge the object. If you're with someone who is choking, perform the Heimlich from behind. Stand behind the person, wrap your arms around their waist, make a fist, and perform quick upward thrusts. Keep doing this until the object comes out or the person becomes unconscious, at which point you'd start chest compressions. Now, for trick number 3. Belly breathing, also known as diaphragmatic breathing. This is another powerful technique to help control your breath. Many of us are chest breathers, especially when we're stressed, taking shallow breaths that don't fully utilize our lung capacity. Belly breathing helps you use your diaphragm correctly. To do it, sit or lie down in a comfortable position. Place one hand on your upper chest and the other on your belly, just below your rib cage. Breathe in slowly through your nose. As you inhale, focus on making your belly push your hand out. Your chest should remain as still as possible. Then, exhale slowly through your mouth, feeling your belly fall. This ensures you're taking deep, effective breaths that fill the lower part of your lungs, which has a better blood supply and is more efficient at oxygen exchange. Like pursed lip breathing, this technique calms your nervous system and helps you regain control. Let's also touch on panic attacks. A panic attack can feel exactly like you're dying. You get chest pain, a racing heart, and severe shortness of breath. It's terrifying, and it's easy to believe you're having a heart attack. If you have a history of panic attacks, try to remind yourself that this has happened before and you were okay. The breathing techniques we've discussed, particularly pursed lip and belly breathing, are your best friends here. They help break the cycle of fear and hyperventilation. Grounding techniques can also be very helpful. Focus on your 5 senses. What are 5 things you can see? 4 things you can feel? 3 things you can hear? This pulls your focus away from the overwhelming physical sensations and anchors you in the present moment. Remember, while a panic attack is not physically life-threatening, it feels that way, and it's always better to be safe than sorry. If you have any doubt, especially if you have risk factors for heart disease, call for emergency help. So, to recap the 3 main tricks. 1. Pursed lip breathing. Breathe in for 2, out for 4. 2. Find a supported position. Lean forward in a tripod stance. And 3. Belly breathing. Let your stomach expand as you inhale. These are your immediate action steps. Remember, these techniques are meant to help you manage the situation while you get professional medical help. They are not a substitute for it. Always call for emergency services as your first step if you are genuinely struggling to breathe. It's also important to be prepared. If you have a known condition like asthma or a severe allergy, always carry your rescue inhaler or epinephrine auto-injector. Make sure your family and friends know where it is and how to use it. Educate them on the signs of an attack. Having a plan can drastically reduce panic and improve the outcome in an emergency. If you've experienced sudden breathlessness without a clear cause, please see a doctor to get checked out. It could be a sign of an underlying issue that needs attention. Thank you so much for watching. I truly hope this information helps you feel more prepared and less anxious. Knowledge is power, especially when it comes to your health. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and hit that notification bell so you don't miss our future content. Stay safe, stay healthy, and we'll see you in the next video.